Now we'll be talking about the medicine levetiracetam. Now levetiracetam is one of the newer drug for convulsions. It is one of the very good drug for convulsions or seizure disorder because of few things. First thing, the drug to drug interaction is much less. That is the reason why it can be safely given with other anti-epileptic drugs. It does not induce or it does not suppress the metabolism of other drug. This is the second quality of the drug. That is the reason why the drug dosage of other anti-epileptic drugs or any other drugs like warfarin or isoniazid or any other such drug can be given very safely without hampering their metabolism or without hampering the drug metabolism of this drug. So it is used as a monotherapy or it is also used as an adjuvant medicine in refractory partial seizure with or without generalization. This is its mainly primary indication, but you name it any convulsion or any seizure disorder. Levetiracetam is one of the earliest or the first drug to start because of its popularity, because of its efficacy, and because of its neutral status regarding drug-to-drug interaction or side effect profile, because it has excellent side effect profile. Over a period of long months or over a period of years, the side effects of like ataxia or gum hypertrophy or osteoporosis or hypocalcemia, all these side effects which are usually seen with phenytoin or valproate or other drugs is not at all there. It is significantly lesser or almost nil. This is the second or third best quality of this drug, that is the side effect profile, which is very good because we know as anti-epileptic drug, those patients who have seizure disorder or brain disorder, they have to take the anti-epileptic drug for rest of their lives, or maybe for 20 years, 30 years, 40 years, 50 years. So over a period of time, that any anti-epileptic drug can definitely create problems by their side effects or adverse effects. That is the reason why levetiracetam is much more safer compared for side effects. Hence, it is safely can be given for years together. It is available in injection form as well as in oral form in the same dosage. It is almost completely absorbed orally. So that is a very good property. So it doesn't get lesser dose concentration. The half-life of the drug is around 6 to 8 hours, and most of the time this drug is given twice a day. Most of the time twice a day is sufficient. If the seizures are there, if the conversions are there, then we can make it 3 times a day also, but most of the time twice a day suffices. As I told, it has very few side effects, and it is also used in myoclonus as well. So other anti-epileptic drugs may not be used in myoclonus epilepsy, or some of the anti-epileptic drugs may even increase myoclonus, but levetiracetam acts there as well. So may it be partial seizure, may it be generalization, may it be generalized tonic-clonic seizure, or may it be absent seizure, may it be myoclonic seizure. Any seizure category we can give this. That is the reason why levetiracetam is very good option for any convulsion or any seizure disorder. It has very beautiful side effect profile, and drug to drug interaction is extremely less. Uh, Whenever a patient is stable, usually we give 500 milligram twice a day. That is the maintenance dose, may it be injectable or on oral tablets. Once the 500 milligram twice a day dosage is given, if the patient is stabilized, if the patient doesn't get convulsions after like 3 to 4 to 5 days, then it is changed to oral form on the same dosage, that is 500 milligram twice a day. If convulsions doesn't stop, then we can increase the dosage of levetiracetam to maximum of 3 gram per day. So this is the reason why this level is very good. I would like to add one thing: when to start an anti-epileptic drug, or when to continue anti-epileptic drug, or when do the patient with convulsion need anti-epileptic drug for rest of their life. The first thing is an abnormal EEG. If the patient has abnormal EEG, in absence of any other metabolic component like sepsis or uremic encephalopathy or hepatic encephalopathy, then that is an indication of anti-epileptic drug for rest of the life. If some patient has a structural brain disease or the structural brain lesion, suppose someone has brain tumor, or someone has brain lesion, edema, or abscess, those patients, with or without operation, they are very highly likely to develop scar epilepsy. So any patient with structural brain lesion, which may get operated or may not get operated, very commonly they develop into scar epilepsy. So these patients need anti-epileptic drug for rest of their life. Any patient presenting with status epilepticus, if they don't have any metabolic parameter, which is the reason for status epilepticus, they have to be put on anti-epileptic drug for the rest of their lives. So these are the most important indications for anticonvulsant drug for continuing for rest of the life. And the fourth indication is if someone is presenting with convulsion or seizure disorder for at least more than 3 times, that too unprovoked, that too without any underlying other disorder, then those patients also need anti-epileptic drug for rest of their life. So that's all for today. Thank you.